Now then, it is 17 minutes past 8. Now here on Breakfast, we've spent a lot of time reporting the difficulties caused by the menopause. Well, a new treatment will become available in the UK later this week, which is giving hope to women who can't receive HRT. It's a daily pill called Veoza or Fezolinetant, and it tackles two of the most common symptoms of menopause: hot flushes and night sweats. It's potentially useful for women who can't take HRT, such as those with a history of some cancers or blood clots. However, Veoza is not currently licensed for women with breast cancer. It's also important to stress that it won't control other menopause symptoms like fatigue and mood swings, and it does have side effects. And while it's now licensed in the UK, it's not yet approved for use by the NHS. So the cost of getting it privately is just over £44 for 4 weeks supply, plus the cost of a consultation with a private doctor. Our reporter, Tim Muffet, went to meet one woman who's been following the arrival of the new drug very closely.
It's like an overwhelming sensation of being near a fire, but you can't get away from it, and it just engulfs your whole body.
As the menopause approached, Fiona's hot flushes began.
They come different points of the day, and they just overwhelm you, so you just stop and you put your fan on and try and carry on your normal day.
Hot flushes and night sweats are very common amongst women going through the menopause, which typically happens between the ages of 45 and 55.
This is a fantastic neck fan, and it just cools you down.
Hormone replacement therapy was a huge help for Fiona, but a breast cancer diagnosis meant it had to stop, as HRT is not recommended for those who've had the disease.
I was very grateful that my breast cancer was very minor. Obviously, the big downfall is I couldn't take HRT anymore. I was crying about that.
Because it's not yet available on the NHS, this drug will cost around £45 per month. Plus, there's the cost of a private specialist needed to get a prescription. That could be around £200 to £300 per visit. And frustratingly for many, this drug is not yet licensed for women who've had breast cancer.
Yeah, that is very frustrating because really we are, I should think, one of the highest in need of it, because other people can stay on HRT, we can't. So I think we should be high priority, really. I'm not in the position to have to pay for it privately, and I really need the NHS to step up and get a move on and provide it for people that, like myself, and people who haven't got that massive income to be able to afford it, so that we can benefit from it as well.
Well, that was Fiona Trimmer finishing Tim Muffet's report, and we're joined now by the GP, Dr. Niyat Arif. Thank you so much for joining us on Sofa this morning. Really interesting this. I think a lot of women will be watching and thinking that maybe if they haven't been able to take HRT as it is, this might be the answer.
This might be the answer for some women, and Fezolinetant, Veoza, which is a drug that about 2 months ago caused a huge splash because it got over from the UK to here for the MHRA licence, and we were thinking this is brilliant because it's a non-hormonal treatment. So what it does is it works on these really special sort of KNDy receptors within our brain and works with the Neurokinin B antagonist by blocking that pathway to the brain in the thermoregulation area of our hypothalamus. So it's not estrogen or progesterone or even testosterone, any of those hormones. It works at a specific pathway for a specific symptom, which is hot flushes. So moderate to severe hot flushes for those that are experiencing in the menopausal phase of their life. However, it's not for everybody, and that's where we need to be able to have those conversations openly.
And it's not yet on the NHS?
It's not yet on the NHS, and actually it's not, it's something that's been considered on NICE as well in regards to guidelines as well. So a lot of the amazing thing that even I as a doctor was thinking, great, there's a non-hormonal treatment. I thought this would be great for my high-risk patients, so those that have under active going treatment for breast cancer or historically have had breast cancer, because for them going on systemic hormone replacement therapy like estrogen, progesterone is not a viable option. They can still go on topical vaginal estrogen, that's different, but systemic estrogen is something that we always worry about because of reoccurrence of breast cancer. But as it stands at the moment with Veoza or Fezolinetant, this drug isn't for those patients at all.
And the cost is obviously an issue whenever we talk about a new drug, isn't it? What's looking at about £40, but also you've got the cost of a private consultation at the moment.
So cost is, there's a bit of a debate around this because I've got a lot of friends that I follow and doctors in America, and it is very, very costly in America. In the UK, the manufacturers have said, look, it's going to be a third of that price. So it's about between £45 to £48. But Sarah, you're absolutely right. With a private consultation on top of that, you're looking at £408. But also what Astellas are saying is this is for those that either are high-risk patients, so they can't have, say, hormone replacement therapy, they choose not to have hormone replacement therapy, then you've got to look at those high-risk patients because the studies that have been done, so there have been Skylight 1, Skylight 2 and Skylight 3B studies, and the data for that we're still waiting for. They haven't come out in the journals, but were presented at Amsterdam. And what they're showing is that when they're saying high risk, they're saying patients who have had active thromboembolic disease, so clots, etc. But actually, if you look at the NICE guidance in 2019, first line is giving back women their hormones. So if you're looking at a lot of patients who are going through the transition of perimenopause, it's because their estrogen is decreasing and their progesterone is decreasing. And so for those patients, what you need to do first line is give those hormones back to them.
Right. So for women who are watching this morning who are thinking, like Fiona in the piece, I can't afford to go private, I can't afford a private consultation or the drugs. What chance do you think that this drug could become available on the NHS in the future?
So we're still waiting to get this in, even in the private sector. It's a long process. So the first thing is please do not go to your NHS GP today asking them for this medication because it is simply not available. Realistically, we're looking at, say, 2025, towards the end of 2025, if for NICE, just to say it's going to be then available on prescription. And then it's going to be clinical care boards who will take up the cost of that and say, is it something that they can viably offer? Hormone replacement therapy, HRT, with the prepayment prescription charge as it stands is much cheaper than this medication that we're offering. However, it is, setting us up in the right way. I'm hoping that the trial for looking at breast cancer patients who are going through active treatment can have a non-hormonal version of this treatment for their symptoms, because they're the ones that are really, in my NHS practice, I'm struggling to look after, because the referral into, say, a menopause clinic on the NHS in my area is about a year and a half. So we've got a long way still to go to manage menopause in this country.
And it's worth saying, isn't it, that it doesn't stop all symptoms, but for those women who suffer really badly with hot flushes and night sweats, it is incredibly detrimental to sort of standard to life, isn't it?
It is, and with Veoza, if you look at the data again from what's coming through, is that some of the symptoms that it said is sleep, but actually only 3% of the participants in the 3,000 people that they looked at for the trial said that sleep was affected, whereas we know with the progesterone component, so utrogestan is brilliant for sleep for us patients. Some of the patients said that their headaches got a little bit better, but this is specifically for hot flushes. That's what they're dealing with. But menopause isn't just hot flushes. If I look at the data, especially if I look at Black and Asian communities, actually, we know about 20% of women don't complain of hot flushes as their primary complaint. They complain of maybe irritability, low mood, cognitive, brain fog, aches and pain, arthralgia. I get that a lot from my Pakistani, Bangladeshi community women. So we've got to be looking at just sort of equity of healthcare within those marginalised communities when we're offering a medication.
So much more being known about the menopause, isn't there?
Yeah,
really,
there is.
Such a conversation. Thank you so much for coming. It's been really interesting. Thank you.